think I'm fine with opening up to questions.
So hospitalizations are up this week. How is the hospital responding to that? What are the hospitalizations looking like? How many people are in there? What's the age range? And how many people of those were maybe vaccinated and unvaccinated?
All right, that's like a lot of questions, but we'll go.
Yeah.
So yes, it is accurate to say hospitalizations are up. Today we have 24 patients in the hospital with COVID-19. If you want to compare that, 10 days ago we had 12. So we've doubled our inpatient census for COVID patients over the last 10 days. In addition to COVID patients, we have just overall very high census for all other conditions at Genesis, as does Unity Point. So we're seeing a lot of chronic illness and a lot of just normal, urgent medical conditions being hospitalized, and then we add the 24 patients of COVID to that. Also, what I would add is that within that 24 patient population, we're a little more heavily slanted right now towards our intensive care unit. We currently have 7 in our ICU in Davenport and 1 in our ICU in Silvis. That's numbers that we haven't seen since the first part of May, and in the ICU maybe even a little bit longer. So we're seeing an increase overall in patients who are hospitalized with COVID. We're also seeing some very sick patients that are ending up in the intensive care unit. The result of that has been that we've been having some intermittent challenges with our ICU capacity. We've had to adjust and at times be on stabilize and transfer and use other ICUs in the region. That's a similar problem that our partner Unity Point has had as well in communication with their CEO, or their CMO. So I think that's a challenge that we're going to face, and we faced it during COVID. You have to be able to take care of the COVID patients and all the other patients requiring critical care. And the ICU is the highest level of care. It's the highest level of nursing training. And so that's a pressure point for us frequently.